Hi, this is Dr. Dean Kelaita with a Calaveras County COVID-19 update. As of today, June 16th, 2020, the state of California has confirmed 151,452 cases of novel coronavirus infections within the entire state of California, with 5,089 deaths. As of this date as well, Calaveras County has reported 26 cases of COVID-19 infection with no deaths. 16 of these cases are considered recovered. That means that the people have gotten better and are back to themselves again. The case breakdown of these are 15 female individuals and 11 male individuals of these 26 cases. The distribution of our cases within Calaveras County are 46% are from the Valley Springs area, 19% from the Copperopolis region, 12% from San Andreas, as well as 12% have been identified in individuals from West Point. 8% have lived in the Upper Highway 4 corridor region of the county near Arnold, and 4% have been identified from the Angels Camp area. Calaveras has seen confirmation of 10 of these last 26 cases, and they've just been reported in the past 14 days, with 7 of these new cases all having been clustered in the Valley Springs area. So that's a bit concerning. This includes 4 cases within a single household. They were all residing together. 2 cases at the beginning of last week were in another household couple living together, and a new single case that was identified and confirmed at the end of last week was in a female adult resident of Valley Springs, epidemiologically linked to a previous case that was reported earlier. In fact, that was our 16th case, was connected to the most recent case of the female in Valley Springs. Also, again, as I said, as a household contact to a previous case. So it's not unusual to see new cases spring up as direct household contacts to other cases due to the transmission that occurs in the home. So people may ask the question, is there an outbreak of coronavirus in Valley Springs? Well, an outbreak is a technical term with a specific definition. So suffice it to say that there is an increase in disease occurrence of the incidence of COVID-19 infections within the Valley Springs area. I think that's the most technical way to phrase what we're seeing here. So there is some community transmission, but it tends to be isolated in a couple of different foci of infection within the Valley Springs area. But this is concerning and warrants ongoing close surveillance. Now that we're relaxing the previous stay-at-home orders and allowing for increasing travel, business activity, and recreational activities to be happening more commonly within our community, it's not surprising to see an increase subsequently in disease activity. And this is something that we're going to have to continue to watch closely within our community as things continue to unfold and activities begin to be encouraged more, and relaxation of the previous restrictions continues. So in response to this reality, prevention remains the most important thing that the community and members of our community can do to prevent the spread and ongoing number of cases of COVID-19 occurring within our county. So again, just to emphasize what those preventative messages are, high-risk people are very much encouraged to remain indoors and to limit activity to just only essential things. Going to the supermarket, getting food, basic necessities of life. High-risk individuals, as you remember, are those aged 65 years of age and older, and those with chronic health conditions such as heart disease, diabetes, other chronic health problems. It's very important to wear a face covering. We say face masks, but technically those are what they use in hospitals and healthcare settings. But a face covering, a cloth face covering, has been shown to reduce the rates of virus transmission. So it doesn't take too long when walking around outside, when venturing out to the store, to see people who are not wearing masks out in public. And this is concerning. I think it's helpful to picture an essential worker, someone who works in a grocery store, who works in a cashier at a checkout line, facing a long line of people coming through all day long without wearing face masks. They see customers all day long, and they're exposed to a lot of people. So, this is not only the scientifically proven, wearing a mask is not only the scientifically proven right thing to do, it really sends a message to others that you value their health and that you're concerned about their safety. So I encourage the public to continue to wear face coverings, and I like to see that when I go out because it sends a signal to others that you value their health and well-being. Testing remains an important part of prevention. If you develop symptoms consistent with COVID-19 infection, testing is a very important way to help identify people who are infected and to get them out of circulating in the public and to isolate them to prevent ongoing person-to-person transmission, to break that chain of transmission from one person to another in public. The testing site at the Calaveras County Fairgrounds will have the date and hours slightly changed a little bit. This is called OptumServe. This test site is located at the Calaveras County Fairgrounds at the Frogtown Fairgrounds, and it's our local COVID-19 testing source. Starting this week, the testing site will be open from Tuesday through Saturday. So it'll now have a Saturday instead of just Monday through Friday. The days will be Tuesday through Saturday from 7 a.m. to 4 p.m. Testing is available to those aged 12 and older. So by moving the testing hours to incorporate a Saturday, our hope is that we can help be more convenient testing hours for people who are working on Monday through Friday. Walk-ins are welcome, but people are highly encouraged to register online by going to the OptumServe website. You answer a series of questions, you give a little bit of your demographic information, and you can get an appointment time to have the testing performed. And that can be done online. And it saves time when you get there. You don't have to go through the registration procedures. You've already done that ahead of time. People without internet access can call an 800 number. It's actually an 888 number, 888-634-1123. That number can be used instead of the website for those without internet access. Now, if testing shows that you're infected with the virus, it means that you could pass it to other people even if you don't have symptoms yourself. That's called asymptomatic transmission, and we've seen that happen. So after you get tested, until you get the results back, or if you develop symptoms of illness, you should stay home except to get medical care. Whether you're infected or not, it's very important to take preventative actions to protect yourself and to reduce the risk for others. So I'll talk a little bit about what some of the symptoms of COVID-19 infection are. These symptoms can appear 2 to 14 days after exposure to the virus. So people with these symptoms may have COVID-19 infection. Fever is probably the primary symptom that people can develop with COVID-19. So fever, chills, cough, shortness of breath, difficulty breathing, those respiratory symptoms that we know about. But some other what are called constitutional symptoms can develop outside of the lungs and respiratory tract. Fatigue, muscle or body aches, headaches, new loss of taste or smell, which is unique to COVID-19 infection, sore throat, congestion, runny nose, some gastrointestinal symptoms such as nausea, vomiting, or diarrhea can be also characteristic for COVID-19 infection. Most of those with COVID-19 infection will not develop severe disease, but we're seeing in California about 8 to 10% of those diagnosed with coronavirus infection will require hospitalization due to the development of those more severe types of symptoms that require hospitalization or even intensive care unit care. Now, against this backdrop of what I've been talking about with COVID-19, the state of California is allowing counties such as Calaveras with stable rates of disease to move into the third stage of reopening. So effective this coming Friday, June 19th, 2020, Calaveras County will be moving into further into stage 3 of the state's 4 stages of reopening, what the state calls their roadmap to recovery. So we're moving along with increasing the availability of new activities. So we'll be reopening additional sectors of local businesses within stage 3 with modifications. So expanded personal care services will join the list of stage 3 activities that are allowable in Calaveras County starting next Friday. And so businesses that can reopen with modification within this stage 3 now are what are just generally referred to as personal care services. And so personal care services are defined as those services that require very intimate exposure from one person to another and entail touching of a client's face, such as facials, electrolysis, waxing, those kinds of services. This guidance also applies to skin care and cosmetology services as well. Electrolysis services would be generally referred to as electrology. Nail salons are another one in this category. Body art professionals, tattoo parlors, body piercing shops, massage therapy outside of a hospital setting. This guidance includes pretty stringent protections that are intended to support a safe, clean, and basically a safe environment for the workers and customers that are engaged in these types of personal service activities. So that's probably the most important point, is that these safeguards will allow these services to resume safely. Calaveras County has shown stable hospitalizations related to COVID-19, and disease rates within our community have not increased to the point where we've seen additional hospitalizations. Calaveras County has met the California Department of Public Health's criteria to be able to move further into these stage 3 activities, which is one of the reasons why we're being granted variance to be able to do some of these things and stay a little bit ahead of the state as a whole with opening of certain business and economic activities within our community. Now that could quickly change, and depending on the preventative actions of the community and individuals here, we would like to see these activities be able to continue to expand, the workplaces to stay safe, and our communities be able to continue to expand those economic opportunities for everyone that live here. So further movement into stage 3 means that certain businesses can reopen, as I've discussed, so long as they really practice the guidelines and are able to meet the requirements that the state has laid down for them to be able to do these activities safely. So just examples of some of the requirements of what the businesses will have to do will be performing a detailed risk assessment and implement a site-specific protection plan. So what that means is they'll have to have a pretty detailed review of what their enterprise entails, and they'll have to make sure that they have a plan on how they're going to carry out those guidelines in detail. They'll have to be training on employees on how to limit the spread of COVID-19 within the workplace and to protect the customers, which will also include how to screen themselves for the possibility of COVID-19 because of symptoms that they could have. And they'll need to have their employees stay home if any of the employees show up to the job site with those symptoms. Workplaces will need to implement individual control measures and screenings for the customers that come in as well. So if you go to one of these businesses, you may be screened by having your temperature taken, or you may need to answer some questions to see if you're sick. They'll need to implement disinfection protocols, which will include environmental cleaning. They'll need to implement physical distancing guidelines. That means that people will need to be spread out and not hopefully be within 6 feet of one another to reduce the risk of COVID-19 infection that we know can happen when people get in close contact with each other. So industry-specific details about how to meet these state requirements will be able to be found at the state's website, or our local public health website has links to those industry-specific state guidance that business owners can look for and download and make sure that they have all the information they need to be able to conduct these activities safely. The Public Health Department will continue to monitor several metrics related to COVID-19 disease activity to ensure that these expanded economic activities, the expanded business practices, the expanded travel now that people are going to be undergoing are safe. So examples of some of these metrics. We want to see less than 12 new cases of COVID-19 infection in Calaveras County every 14 days. We want to see a level of testing continuing to take place among our residents, so we have good surveillance data on our population. So our goal is to test 70 to 80 people a week in Calaveras County for COVID-19 infection. We want to ensure that the hospital, the local hospital in San Andreas, Mark Twain Medical Center, has the capacity to care for a potential influx or surge of COVID-19 patients if that were to arise. We want to make sure that they have enough hospital beds, they have enough intensive care unit space, and they have enough ventilators, which are machines that help people breathe if their lungs are injured by COVID-19 infection. So as long as these factors and these metrics are being met and satisfied, and the data remains encouraging, Calaveras County will continue to move in sync with the state in opening up additional sectors of our society and our economy, and continue to maintain the health and safety of our residents. And that's my primary focus, is the health and safety of this community. And as the local health officer, I'll continue to monitor the situation along with the public health department and along with our partners in community in health, the local medical community, our other partners that help us in public health. And we'll make sure that by increasing these activities in Calaveras County, we'll always be able to keep the health and safety of our residents our #1 focus. So thank you for your support, and thank you for all the efforts you're doing to keep our community strong and healthy.